It was a shock, big shock, you know, because I was healthy and never was in the hospital before, like, you know.
1 in 3 of us will get cancer at some stage in our lives. And when we do, the most important thing we need is effective treatment. In July last year, Richard Dowling got some grim news.
One Sunday evening, I wasn't feeling too well, and I phoned my sister, and we have a care doctor down the clinic. He made an appointment, I went down to see him, and he put me up on the bed and examined me and said, "I think you have to go into the hospital." The cancer was in the colon, and it was that serious they had to operate straight away.
While there have been dramatic improvements in the diagnosis, treatment and recovery rates for all types of cancer in Ireland in the past 20 years, increasing specialisation has meant cancer services are further away from many rural communities.
There's a dilemma because undoubtedly the best outcomes are obtained when patients attend specialist units. It is not possible to have specialist units all over the country, so what we have to improve on is a patient's ability to access the services.
With the move to the Centres of Excellence, there is now 8 of them around the country, and all cancer treatment, initial treatment, is being moved into these centres. People are travelling longer and longer distances.
For people living in rural Ireland, the most difficult part of cancer treatment can be getting to the hospital, especially from remote areas. Richard lives in Arklow. His chemotherapy treatment involved trips to St Vincent's Hospital in Dublin. Not easy when the illness and treatment sap your strength.
I had to come back down to Arklow to go up to get chemo, which meant is you went up 1 day every 3 weeks to get the chemo in the arm. First of all, when you went in, you have to give the blood, and you have to get the blood analysed, and that would take an hour, and then you would sit with the drip in your vein for 6, 7 hours, 8 hours. When you came home the next day, then you started on six tablets a day for 3 weeks, and then you came off for a week and back up then again for the drip again.
And would you be weak after the treatment?
You'd be weak for a while, but after a few hours then, if you walk around the house, you'll be okay. You'll be able to go out the next day.
To ease the burden of long journeys for cancer patients, the Irish Cancer Society set up a pilot scheme called Care to Drive. This relies on volunteer drivers to take the patients to and from their hospital treatments.
If you got a problem, don't care what it is. If you need a hand, I can assure you this, I can help.
Tom Lynch is a retired forestry contractor from Ballymoney in Wexford. He volunteered for the scheme because he had a friend who had cancer and he wanted to do something to help.
About once a month we collect a patient, take him to Dublin. Maybe you might collect him 8:30 in the morning, have him up to Dublin for 9:30 to 10 o'clock. When his treatment is completed, then you collect him again and bring him home, drop him at his door. I suppose the good thing of the scheme itself is the person is collected at his own door. As soon as the treatment is finished, the car is waiting for him at the hospital and drops him straight back. Whereas if he was on public transport, he may be waiting at bus stops. It takes the hassle and worry of that from him. Cancer patients now, some of them are now maybe not able to work. So there would be financial problems trying to get public transport or maybe taxis. So that's one of the very good things about this scheme, that there's no cost to the patient. After treatment up there, coming out of the hospital, they're tired, maybe feeling unwell. So it's a great thing that the cars were at the door for them as soon as they walk out of the hospital. It's there and drops them back at their own door without any hassle.
You make it sound very simple, but for the driver it can be a long day as well, can't it?
Well, it is, but when you sign up or volunteer for something like this, you're prepared, you do it and you know that it's time, so what? You're doing some good for somebody and helping somebody. And I suppose at this stage in my life, it's nice to maybe give something back.
With Tom going up and he's into hurling and football and sports and stuff, and it'd be the same with me, like, and whatever matches was on the GEA or the soccer or whatever, and the time passes, flies by, like, you know, you're up there before you know it, like, you know.
Yeah, one gets to know the patients. I suppose I would have taken some of them now maybe half a dozen times, and of course an hour and a half each way. You're bound to strike up conversations and get to know them very well, which again maybe makes it a lot easier for them that they're travelling then with somebody that they can maybe confide in, and the driver's there maybe to give any little extra help that he can for them, make life that little bit easier for them.
The Irish Cancer Society is a voluntary body set up to support cancer research and patients. The Care to Drive scheme is just one of many programmes it organises to help cancer patients in Ireland.
It's been hugely successful. We've started in May 2008. We have 111, I think, drivers. We've had about 120 clients to date, and we have covered about 1,500 journeys to and from the hospital with those patients.
Is it difficult to get people to volunteer?
No, it's been actually amazingly easy to get people to volunteer for this programme. 50% of our volunteers are men, which is unusual in our business to get so many male volunteers. But they feel it's something very practical that they can do.
The value of voluntary support in the treatment of the disease is incalculable. But it will be even more important as budgets tighten all round the health service.
Hold that for a moment, okay?
If we can provide a system whereby patients do not have to worry about access to the service, where they have confidence, where they have comfort, where they have security, it takes a huge weight off their shoulders, and it allows them to proceed with their treatment without interruption. It has made a huge difference to many hundreds of patients already, and it's certainly a service that we would like to see more widely available.
Twice is only one day in the month.
No, that's very much now. That's another day gone.
If one isn't prepared to make some of the sacrifices at this stage of one's life to help somebody else, well, it's a poor lookout.
Okay. All right, lad. Thanks, Tom. Okay.